Okay.
Another reason why nurses quit nursing is because of the hierarchy that exists in our healthcare system and just feeling silenced and undervalued by the system. Even though a lot of healthcare organizations and facilities have tried to create a safe environment, the reality is that there are limited opportunities to express our truths and what we see, and to express ourselves if we see something going wrong or we have a different opinion from, let's say, a prescriber as far as what they're recommending for a patient. When you don't feel heard, when you don't feel valued, it makes it really hard to show up for work every single day. The reality of our world, of our healthcare system, is that physicians' opinions are often prioritized over ours. There's this hierarchy. And I'm not speaking badly about physicians. I know a lot of really amazing doctors. But the reality is a first-year resident or first-year intern has more say over a nurse who's been on that unit for 20 years, at least as far as the hierarchy goes. Now, of course, the smart intern, the smart resident, will listen to the opinion and the expertise of the more seasoned nurses, but it doesn't always happen. Because of how our laws and licenses are structured, we don't always have autonomy in what it is that we think is in a patient's best interest, or we struggle advocating for what that patient wants. And it can be really frustrating when we see decisions being made that, number one, aren't in our patient's best interests, but number two, are also not in our best interest as nurses. And any facility that is spending billions of dollars building a new facility, a new hospital, and they're not asking the nurses about plugs and spacing and logistics, they're going to regret. The minute they open that hospital, they're going to regret it, because the nurses know how to care for their patients and they need to feel heard and valued. If you're feeling frustrated and silenced and undervalued, head on over to my website, divinelyjennifer.com. Let's help you step back into your power. You don't have to be a victim of the system, nor do your patients. You know what needs to happen. Let's give you a voice.